Dobry dzień. Hello, Professor Sartorius. Thank you for this introduction. So I am going to discuss with you about the planning for the future of child and adolescent psychiatry and not mental health, and you will see that the difference is very important, as we have seen in the previous presentation that were really great. Next slide, please. I have no conflict of interest for this talk. Next slide, please. Well, the common sense concerning what should be child and adolescent psychiatry in the future should be we just have to provide evidence-based treatment to all children and adolescents who need it. Unfortunately, next slide, this is not the good direction. This is not the right direction. Why? Next slide. Because this is not sustainable. This is just impossible to do that in all countries at the moment, and you could say, but perhaps in the future it could be possible. I don't think that in 10 years, in 20 years, it will be possible. So we have to change our mind about what should be the future of child and adolescent psychiatry. Next slide. So why is it not sustainable? If you consider, on my opinion, the best epidemiological study that has been done to estimate the prevalence of mental disorder in adolescents and children, it is the NCS Adolescent Supplement Study. There is a lifetime prevalence of about 50% of mental disorder in children and adolescents. And if you consider my country, France, if we want to treat all these patients with evidence-based treatment, all 10,000 psychotherapists that exist in France should treat only children and adolescents. And this is just impossible. The second problem is that, okay, you have evidence-based treatment, they are published in international peer-reviewed papers, this is fine. But from where comes this research? From rich Occidental countries. And do you think that this treatment can be applied directly in countries with different culture, with different professionals? This is the real question. And in addition, when I said that we should provide evidence-based treatment to all children and adolescents who need the treatment, but who are these children? Do you think that the adolescents and the children that were pointed in the NCS Adolescent Supplement Study, the 50% of these children and adolescents, really need psychiatric treatment? There was a very interesting paper by Spitzer in the Archive of General Psychiatry who said psychiatric diagnosis and need for treatment are not the same. And so we should be very clear about who should we treat with psychiatric treatment. Next slide. So what? So what? We have to answer big question, and not top-down question, but bottom-up question. First, we have listened to very interesting conference about mental health, but what is child and adolescent psychiatry? Is it the same as mental health? Obviously it's not. Professor Sartorius pointed very correctly that there are many important societal mutations at the moment. Do we, psychiatrists, have to deal with these societal mutations, and to what extent? And you know at the moment that in many countries there is a question about the usefulness of child and adolescent psychiatrists. They cost so much, and perhaps psychologists could do the same job. And so there is a very basic question: what is a child and adolescent psychiatrist? And about evidence-based medicine, we have to extend the concept with the notion of inclusive evidence-based medicine. And last but not least, when you are dealing with psychiatry, you are dealing with a local mental health care system. You cannot change it like that. And if you want to improve your mental health care system, you have to come from what exists. Next slide. So, what is child and adolescent psychiatry? For many people, and in particular for adult psychiatrists, child and adolescent psychiatry is just a psychiatry of little persons. Next slide. But this is not correct. This is not correct. There is a big difference between adult psychiatry and child and adolescent psychiatry. And it is not easy to define what is child and adolescent psychiatry. Here is a proposal of definition. This is a discipline dedicated to the treatment of a community. We face families. And this is quite a big difference with adult psychiatry. And this community calls for help. They come to see us because there is some suffering, and this word is very important. And the suffering, where is this suffering? In mind or behavior. Previous slide, please. Thank you. So there is a treatment. This is a discipline dedicated to the treatment of a community that calls for help, for some suffering in the mind or behavior. And this suffering is located in a youth. And this is very important for clinical practice. People bring us a child or an adolescent, but it is the community that calls for help. And obviously, this is not simple to deal with that, and this is even more complex to explain it to societies and to communicate on it. And so there is a big problem, much wider, which is that in fact child and adolescent psychiatry with this definition is completely different than child and adolescent mental health, as it has been presented in the previous presentation. Mental health, as defined by WHO, is related to well-being, self-actualization, and productivity. And obviously, this is not in line with the definition of psychiatry I propose to you. And even if there is a common border about primary prevention, we have seen it, to deal with mental health is very important to prevent mental disorder. And this is obviously the best way to deal with psychiatry. This is to prevent mental disorder. But anyway, we cannot prevent anything, and unfortunately, we still will have in the next decades many children and adolescents with mental disorder, and we have to deal with these patients. The problem is that for politicians, this is much easier to give money to mental health than to give money to psychiatry, because the word mental health is so pleasant, and because everybody wants to make children happy. And at the opposite, to give money to child and adolescent psychiatry, this is not very popular. And so, at the moment, in many countries, nearly most countries on the planet, there is a lack of money in child and adolescent psychiatry because a lot of money go to mental health, which is fine, but there is also a need for money for psychiatry. Next slide. So, concerning, as Professor Sartorius presented it, at the moment there are plenty social mutation. About the climate, which is a big problem for everybody, but in particular for young people. The question of gender, of identities, of social media, of school pressure, etc. And so we are very worried for the next generation. But there is also the risk of an overuse of child and adolescent psychiatry. This is not because there is an anxiety about the climate, which is correct, that this anxiety is a mental disorder. And so there is a risk that we use the word psychiatry to deal with all the problems that our society are facing at the moment, and this is not good. And so how to make the selection between all these societal problems and psychiatric problems, the split is the notion of rupture. A psychiatric patient is a patient that suffers in mind or behavior and suffers so much that there is a rupture in his or her existence. And whether it is an adult, an adolescent, or a child. Next slide. So now, if psychiatry does exist, what is a child and adolescent psychiatry? And first, it is a physician And even if psychiatry deals with the mind, and even in all societies on our planet, human beings experience a split between what is called interiority and physicality. And this has been shown by the anthropologist Philippe Descola. Even if we are dealing with the mind, children and adolescents have also a body. And, for instance, in anorexia nervosa, obviously, you need to be a physician also to deal with this very severe eating disorder. A child and adolescent psychiatrist is also a person that can conduct highly technical interviews. Surgeons can do very refined things with their hands. We can do very sophisticated interviews with our words. And this is a job, this is a very technical job, and we have to defend it. Psychiatrists, they know also how to manage a team. And as you know, child and adolescent psychiatry, this is the problem of a team, how to deal with a team that can treat a patient. A psychiatrist is also a person that can make a serious decision in a minimum of time because we are trained for that. And this is a big difference with psychologists who can do also, obviously, very highly technical interviews. And psychiatrists in all countries are associated with some form of authority. And this is important in our interview. Our voice can be very impactful, and we have to be aware of it and we have to use it. Now, next point, how to think about an inclusive evidence-based medicine. Of course, we need research. Of course, papers are crucial. And now we can read all over the planet paper, a randomized control trial of a high quality that can point which treatment are better for this type of patient. Of course, this is true. But these results have to be interpreted according to local culture, local resource. And I love what Olayinka Omegdobun, the past president of Yakapap, said. She comes from Nigeria, and she said, we have in Africa different resource countries. In some countries, you have resources that are not known in rich countries, and we have to develop this different resource. And of course, you have to organize the local mental health care system. But it takes time. This is difficult to change the mental health care system, and it involves a lot of people. And so we need a bottom-up and not a top-down evidence-based medicine. And this is the reason why qualitative approaches are very important in some kind of inclusive evidence-based medicine to be sure that these treatments are adapted to local culture. And politicians, administrators, and sophisticated professors have to acknowledge it. Next slide. And so this is my conclusion. The future of child and adolescent psychiatry, we have to go beyond the common sense perspective. Because the common sense perspective is some kind of pseudo-science, and it can be misleading. And so to plan the future, we have to consider very bottom-up question. What is child and adolescent psychiatry? This is not mental health, and we need psychiatry, and we need mental health, and we need that also there is some money in both directions. We need to deal with societal mutation, but all the problems that are related to societal mutation are not necessarily psychiatric problems, and this is important to say it. We have seen what is a child and adolescent psychiatrist, we have seen that an inclusive evidence-based medicine is necessary, and we have to think about the organization of local mental health system. And I will say thank you very much. Spasiba.